I'm Dr. Sherry. I'm from Back to Health 360, and I'd like to introduce Anthony to you. Anthony's joining us today for a chiropractic treatment. Anthony comes from a track cycling background. He's a world champion track cyclist as well as Australian champion. So today we're going to show you a little bit of what we do with Anthony to help him keep performing at his best and continuing to set personal best records. So for an athlete, it's very important that the pelvis remains very mobile. And what we find in many athletes, and particularly cyclists, that they become one side dominant and the pelvis will fixate as a result. So today I'm going to show you how we would adjust the pelvis, and in Anthony's case, the left side of his pelvis. So we use a drop table, and the drop table comes up from underneath the patient. Then we come in, we apply a force using both Anthony's body weight and the spring loaded of the drop table. So we come down and with a push, like so, and that completes the adjustment. Now we're going to come in and mobilize some of Anthony's thoracic, so some gentle mobilization, and we're using a tool that's called the arthrostim. So the arthrostim here, it's a spring-loaded tool, it's electric, it oscillates 14 times a second. By doing so, it shuts down the pain receptors to the brain, so the brain actually relaxes the muscle tissue, quieting it down so we can get now, this is some general mobilization. In a moment, I'm going to show you how this tool is actually used to adjust the spine very gently. In particular, we'll be showing you an adjustment of Anthony's cervical spine. And we're going to show you some of the soft tissue techniques that we use. In particular, active release technique. Active release technique is the gold standard in soft tissue work that is considered around the world. And what we're accomplishing with this, we shorten the muscle fiber, we take a tension on the muscle and take it through a full range of motion while we strip out the adhesions or the scar tissue in the muscle and re-elongating the muscle into its stretched form. So to do that, today we're going to work on a hip flexor called the psoas. In through here, so I'm going to have Anthony bend his knee coming forward. I take a tension on the muscle, and now Anthony's going to straighten his leg, extending the hip back, and stretch. It's a great stretch. It feels good, doesn't it? And coming back. So we'll repeat this a number of times until we address all the adhesions in the muscle fiber, restoring the flexibility that we need. One of the other key moves that we use for Anthony is called mulligan, and we're going to use the mulligan technique to mobilize Anthony's hips. So he's very tight through the hips, and in cycling this is very important that we remain mobile. So we find the fixation in the actual hip joint. So to mobilize this, we're going to bend the leg. I'm putting a strap around myself and around Anthony's leg. Coming through here, we bring the leg up. I'm taking some tension so you can see I'm leaning back into the strap, and we're mobilizing the hip. This is wonderful for any impingement syndromes that happen in the pelvis, in the hip joint in particular. It's also good for people who have arthritis in the hip and are losing the space in their joint. One more time. And restoring that beautiful motion. So in Anthony's case, he's a cyclist, he's using both legs. We're going to come in, we're going to do both sides. And coming to the opposite hip, taking tension, distracting the femoral head out of the acetabulum, and mobilizing that joint. Now we're going to come up and we're going to check the alignment of Anthony's neck. We always work head to toe in chiropractic. It's a total body treatment. I'm using the tool again called the arthrostim. So we're going to use the tool. You can see it has a blunt tip to it. So we're going to address any cervical spine alignment issues in his neck. It's a beautiful tool in the fact that we can actually take Anthony's neck through a range of motion while we gently palpate and adjust the cervical spine. So we have a vertebra out of alignment at the top of Anthony's neck, and we come in with the tool, and it's a little tapping and movement at the same time. gentle, low force, extremely effective. We also use cold laser therapy in the practice. Cold laser therapy is a state-of-the-art treatment that helps reduce pain, reduce inflammation, and promotes faster healing of the tissues. It works at the level of the cell, so we are able to treat any tissue in the body. So whether it's a muscle, a nerve, a bone, even organ issues, we're able to treat with the cold laser to help facilitate healing, reducing inflammation, and thereby the pain. We have a couple of different lasers in the practice. The one I'm going to show you today is called multi-radiance. It is a TGA approved cold laser. You'll see the red light. That is the laser that's happening here. As we treat, we're treating Anthony's knee today. So we'll actually come down to the tissue, holding the laser. And the unique part about this laser is there's also a scanning tool that we're able to turn on and scan for the actual damaged tissue. So the laser's able to detect where the damage is. It'll beep when it finds it, letting us know when the tissue beneath the head is to be treated. We set that head back down, and then it will beep again when the amount of treatment has been supplied to the tissue. Average treatment lasts approximately 5 minutes. All right, Anthony, you're all done today.
Thank you.
You're welcome. He's ready to go out and set another record and another world championship.